Go through the case notes. Hello and welcome to Seven Sentinels. This is Grandmaster class and I am Peter Simon with you. Study the case notes. Second page. We'll be doing writing task and speaking. So first we'll write the address. Number 1, the address. Yes. So here we are writing a discharge letter to Craig Hemsworth, the GP, general practitioner, and his name is Dr. C. Allen Jones. So it is Dr. C. Allen Jones. So Dr. C. Allen Jones. Right. Dr. C. Allen Jones. And who is he? General practitioner. Is a general practitioner, GP. So general practitioner. Yeah. General practitioner. And it is a 68 Riverside Clinic. 68 Riverside Clinic. So 68 Riverside Clinic. Yeah. And next it is Newtown. So this is the address. This is the address. Take your notes, so, and try to take the notes from here. So it is Dr. C. Allen Jones, number 1, GP, general practitioner, 68 Riverside Clinic, Newtown. So this is step 1, the address. Yes, we have got the address. So next one, leave one line and write here. What are you supposed to write? Yeah, come on, what should you write here? Second part. So number 1 is the address. Number 2, we have to write the date. Where is the date? This is the date, recent one, 22/8/2019. So you can check today's date. Today's date, discharge date is 23/8/2019. Okay, this is the date. and anywhere today's date is given, you have to check here. So 22, this is the last. And discharge. Patient anxious about seizures at home after discharge. So you have to check here. Okay, when is the discharge? So previous day, discharge education has been provided. Okay. So today only discharge. So you have to write this date, 23/8/2019. So 23 August, 23 August 2018, 23 August 2019. Yeah, one line you have left. This is number 2, the date. So the address and the date. The next third one. Third is the salutation. Salutation. So to whom are you writing? Dr. Jones. This you have to take. Dr. and Jones. So dear Dr. Jones. Dear Dr. Jones, comma. So put a comma after dear Dr. Jones. So the salutation is done. Yes. Next one, fourth one, the subject line. The subject. Fourth one is the subject. So you have to focus in these areas. Right. Step by step you have to follow. So leave one line again. After every component you have to leave one line. Yeah. Yes. What is the subject line? Mr. Craig Hemsworth. Mr. Craig Hemsworth. Aged 52. Date of birth is not given. So just, yeah, aged 52. So this you can write. So regarding colon Mr. Craig Hemsworth, comma, aged 52. Aged 52. Yeah. Regarding Mr. Craig Hemsworth, aged 52. See, this is the, yeah, this is the introductory points. Then you have to leave one line and then you'll write the body of the letter. Okay, the body of the letter in 5 paragraphs. The body of the letter in 5 paragraphs. We'll focus on this body afterwards. Now, once the body 5 paragraphs are over, then you'll write the conclusion. So this is the first paragraph. Okay. You can write the body of the letter in 5 paragraphs. So you can say the introduction. So 1 paragraph. Then you write the main body, paragraph 1. Okay. The main body, paragraph 2. And next, the main body, paragraph 3. And next one, the conclusion. So the conclusion. So 5 paragraphs. After that, leave one line, and here the name of the doctor is given. So you have to write yours sincerely. If the name is not given, just a general practitioner is given, then you have to write yours faithfully. If the name is known, then you have to write yours sincerely. Name is not known, then yours faithfully. So the name is known. So it is yours sincerely. And then leave 2 lines. Leave 2 lines, 1 and 2, 2 lines you leave. And then you will send the address. Address is here, your address. You are a nurse in the general word, so registered nurse. You can take it as it is, registered nurse. Registered nurse. Capital letter. Registered nurse. Then general ward. General ward. So general ward. Then next one, King's Hospital. King's Hospital. Then next one, Cliff Rock. King's Hospital, Cliff Rock. Yeah. So that's finished. So this is the closing remarks. The closing remarks. Okay. The closing remarks and 7. The sender's particulars. So the last one is the sender's particulars. So I hope you understand the 7 parts. This is number 1, the address. Address. Okay. So to separate this one, yeah, the address, then the date, then the salutation, okay, focus on these areas. So the subject, and then the closing remarks, and the sender's particulars. So focus on these areas. These areas are very, very important. And 5th one is the body of the letter. Body of the letter. Yeah. The body of the letter in 5 paragraphs. Let us put it here. Yeah. So we have covered all these areas now. Now only the body is remaining. Okay, this is the area we have to focus now. That's what we have to think about. All others are completed. Other than this, everything is done. Yeah. So five body paragraphs. That is what you are supposed to write. This will go into the, yeah, so far everything is clear now for you. Other than this, everything is done. Right. So is that clear? Other than body, everything is clear. Come on. Just if it is clear, let me know so that we can move forward. Yeah, just at least give a letter Y for yes or N for no. Ah, so there are three yes. One is Simiat, Avil, and Srija. What about the others? You did not get any idea? Yeah, just to give a yes or a no, please. Yeah, thank you, Kamal, Vinita. Yes, we can move into the second part. That is, yeah, second page. So this is the introduction. We are going to write the introduction. Okay, let us take the introduction. So how are you going to write the introduction? What are the things that you want to write in the introduction? Let me know what you want to write in the introduction. Yeah. Now tell me, what will you write in the name introduction? Give me one by one so that I'll carry them forward. So the name of the patient. Will we write the name of the patient if you know that we are going to write the name of the patient? So you can write that word so that at least three people can write, then I'll carry that word there. Name of the patient. Write the name of the patient, I'll carry. What is the name of the patient? Yeah. Don't miss this special section. You have to become perfect means you need all these things. Yeah, Mrs. Craig Hemsworth. How did it become Mrs.? Simiat, it is Mr. Craig Hemsworth, right? So here it is. Copy text. Okay, I'm carrying you. Yeah. So we'll take this Mr. Craig Hemsworth. Carry it forward. Yeah. One thing has come. What else should be carried? Yes. Come on. What else should be carried forward? Diagnosis. What is the diagnosis? Yeah, diagnosis should be, so the name of the patient. Okay. So this is the name of the patient. The patient name. Okay. Then the diagnosis. So one by one we'll take. What is the diagnosis here? Find out the diagnosis. What is the diagnosis? Two or three people write, then I'll carry it forward. Yeah, tonic, clonic, seizure. Yeah. Where is the diagnosis? Here is the diagnosis. Copy text. Yeah. Carrying forward here. So tonic, clonic, seizure. Okay, that is the diagnosis. Okay, next. What else? What else do you want to write in the introductory paragraph? Requires purpose. Okay, what is purpose? Come on, what is the purpose? Purpose you'll get here. Using the information given, write a discharge letter. What type of letter is this? What type of letter is this? Type of letter. The type of letter. What is the type of letter? Discharge letter. So here it is. You're writing a discharge letter. Copy text. So you have to say is being discharged. Discharge letter. This is a discharge letter. Yeah. Next, what else? Yeah, what else you have to write? So purpose. What is the purpose? Patient to be monitored. So regular monitoring, ongoing monitoring, and follow up, safety alert management. So you can say ongoing, ongoing monitoring or regular monitoring or continuous monitoring. Yeah, and appropriate management or follow up care, whatever, and appropriate management. Okay, so we can write these points. What are the purposes? So ongoing or regular or continuous or continuity, regular monitoring is one, and appropriate management. Yeah, regular monitoring and appropriate management. Okay, what else? What else? So monitoring and management, there's follow up, care, and everything. See all these things. Okay. Yeah. Right. Then what is his present stage? Present stage is admitted. Is admitted. So is admitted here. Is admitted. Okay. Admitted when 19 to 23. So admitted. Okay. Admitted. Achievement. How many days before? 4 days before. So recently admitted. Admitted recently. Okay. 4 days ago. Yeah. Admitted recently 4 days ago. Yeah. And what else? Okay. Yeah. Come on now, all of you take this. Okay. So you can see here what are required. Discharge education, Discharge plan, discharge education, wife included, patient to be monitored. Okay, patient discharge education. Education should be provided. Then, yeah, writing to the patient's GP. Okay, continuation of anticonvulsant medications. Follow up after 2 weeks has been scheduled. Review for anticonvulsant therapy. Safety alert banned. Avoid driving, avoid strenuous activities. Regular sleep is recommended in addition to healthy diet. Okay, now which paragraph will go into where? That we have to see. Okay, so now here there are three paragraphs. What paragraph, what will go, we have to notice, right? Come on, now you can write your introduction. Yeah, Vinita has written, thank you for seeing Mr. Craig Hemsworth, who has diagnosed or who has been diagnosed. Okay. Tonic diagnosed with tonic-clonic seizure. He requires appropriate evaluation and management following the discharge back home today. Yeah, Kamal Tucker. I'm writing to update the current health condition of your known client. No need to write your known client. If he already knows, you need not tell him your known client. He already knows. No, if you don't remind him, does he not know? So no need to write known client, all these things, patient, client, known, unknown. So if it is unknown, it's already you are introducing. Okay. Right. Who was diagnosed with tonic-clonic seizure. He requires ongoing care and appropriate management following the discharge back home today. Right. So okay. You can write in different styles. Very good. Come on, you can write your own sentences. Mr. Hemsworth. No need to write full name. Mr. Hemsworth, who yeah, was diagnosed with tonic clonic seizure. Like that you can write. Requires. Okay, this first simple sentences will write. Okay. Mr. Hemsworth was diagnosed with tonic clonic seizure. Okay, that is what you can say. And you can take another sentence. Mr. Hemsworth, Mr. Hemsworth was admitted to the hospital or to our hospital on which date? 19 August 2019. On 19th August 2019. Yeah. So different types of sentences. Afterwards, we can write big sentences, but first let us see what are the sentences that you want to write. Srija Ravindran, Simiat. Yeah, before who you need to write a comma, Kamal. Mr. Hemsworth, who has been diagnosed with tonic-clonic seizure. Simiat, no need capital letters. TCS, no need capital letters. Write small letters like this. Okay, he has been discharged today. He has been discharged. No, he will be discharged today. He is going to be discharged today. He's scheduled to be discharged today. Not he has been. Not finished. Discharge is not finished and requires appropriate management and care following the discharge, you can say. Mr. Srija. Mr. Hemsworth was diagnosed with tonic-clonic seizure, requires follow-up care and appropriate management following his discharge today. Very good. Mr. Hemsworth was diagnosed with tonic seizure, requires he remove he. Okay. He requires not only ongoing care but also appropriate management following the discharge back home today. Otherwise, everything is correct. Otherwise, we can write two sentences. Mr. Hemsworth was diagnosed without who. Okay. Then two separate sentences you can write. Otherwise, single sentence. Mr. Hemsworth, who was diagnosed with clonic seizure, remove he, requires not only ongoing care but also appropriate management following the discharge back home today. Yeah. So next one. So he was admitted to our hospital on 19th August 2019. Okay. So he had an episode of tonic clonic seizure. He had an episode of tonic clonic seizure. So he was admitted. Mr. Hemsworth was admitted to our hospital following an episode of tonic clonic seizure. Like that also you can say these two. You can join and write into one. Okay. So anyone you can write. This no need to write two. So he had an episode, right? And next. So he is being discharged back home today. Is being discharged back home today, or he will be discharged. Okay. Today. Okay, fine. Next one. He requires. What does he require? Ongoing care or continuity of care or regular monitoring and appropriate management. Okay, all these sentences you can write together. Okay, all these sentences you can write together. This is how you can write the introduction. Okay. Yeah. So either way, any way you can write. So that is introduction. Next, three body paragraphs you will write. Three body paragraphs. So next, okay, main body paragraph one. Yeah. Next one, the main body paragraph one. The main body paragraph one. So in the main body paragraph one, what are you supposed to write? What are you supposed to write in the main body paragraph? Now we have to see this discharge plan. You will write in the main body paragraph 3. Main body paragraph 3. This you will write in the main body paragraph 3. Remember that. This is the third paragraph. Discharge plan is third paragraph after discharge. Okay. Yeah. Now during hospitalization. Okay, investigations and management. Okay, management in the hospital. So this you will write in the main body paragraph 2. Okay. Main body paragraph 2. Whichever is important, you will write, not everything. Right? So medications and what are the activities that are given during management. Okay, this is main body paragraph 2. This will go into main body paragraph 2, right? Main body paragraph 2. Yeah. Then investigations. Okay, next one. So then before admission, reason for presenting this one. This is in main body paragraph 1. This you will write in main body paragraph 1. Okay, main body paragraph 1. Yeah, so this will go into the main body paragraph 1. So what is important that you have to write? What is not important, you should leave. So this main body paragraph 1, diagnosis. Okay, so next one. So during hospitalization is in main body paragraph 2 and discharge. So before admission or at the time of admission is paragraph 1. Okay. During hospitalization management is paragraph 2 and discharge plan is paragraph 3. So now let us see what are we supposed to write. Come on, can you tell me what should go into body paragraph 1? So do you think that rushed to emergency department? So rushed to emergency department. Rushed to the emergency department in an ambulance. Should we write this yes or no? If you say yes, then I will mark it. Come on, respond. Should we write this in the body paragraph 1? So I will say no. Hmm. The patient's GP. But does he know already that was rushed to the emergency department? So did they wait and inform the GP and then bring him here, or did they take him to the GP first and did they bring from there? No, emergency department he just came. So yeah, you have to write that. Okay. So brought in by ambulance. We can say brought in by ambulance. Yeah, brought in by ambulance. So this is it. Had a sudden fainting, unconscious. Fainting and became unconscious. So all these no need to write. Write the important thing. So right, you can say this one. This point you can use. Yeah. So wife accompanied and wife was telling all these things. Okay. So copy text. So this you can write. So rush to the emergency department in ambulance. Rush to the emergency department in an ambulance. So you can write this one point. Okay, this one point you can write. And what happened? So his wife reported some points. Yeah. So jerking movements of arms and legs for 2 minutes. Okay. So you need not write 2 minutes, 3 minutes, but you can write about the jerking movements. Okay. So jerking movements. Yeah. jerking movements of arms and legs, or you can say limbs. So whatever is important, you write there. Okay. So wife accompanied, and wife is telling all these things because is unconscious. Is unconscious. So wife plays a very important role here because is unconscious already. So next one. So jerking movements of arms and legs. So why wife accompanied? Because he could not come on his own. So she called the ambulance and all these things maybe. So what happened here? So was waiting for the bus in bus station, had fainting. Yeah, he became unconscious. He was brought in an unconscious stage, had sudden fainting, and he became unconscious. So that is why, because he cannot do anything. So that's why wife role is important here. Yeah. Then next, he lost his consciousness. Face blue. Breathing stopped for 20 seconds. Face blue. So he turned blue and he regained consciousness. Okay. Breathing stopped for 20 seconds. He was unconscious here. And face became blue. He turned blue. Okay. Yeah. Face became blue. Right. Then afterwards, what happened? Um, yeah. Incontinent urine. Recovered consciousness. He recovered consciousness after 2 minutes. Say jerking movements, 2 minutes, then afterwards. So this is another point you can take. So recovered consciousness after 2 minutes. Then yeah, now you can see. Is anything else you want to write from here? Now complaints of headache. Maybe he got hurt. He's complaining of headache. Okay, maybe he got a head hurt where head injury from a car accident 2 months ago. So here it is. This also you can involve. Yeah, write your sentences based on these points. So he has occasional headaches and blood vision. Maybe because of this only yeah, blood vision, occasional headaches. So yeah, come on, you can write your sentences. Yeah, all of you write your sentences. Okay, now let us see how you are going to write the sentences. So, writing sentences is an art. It's not so easy. So, we learn how to write sentences. Yeah. So, first a sentence. So, did he come? No, he did not come. So, you can write Mr. Hemsworth, okay, was brought to the hospital, to the Mr. Hemsworth was brought. Where was he brought? Yeah, to the emergency department. So brought to the emergency department. Mr. Hemsworth was brought to the emergency department. Okay, and brought to the emergency department. Brought in. Okay, BIBA brought in by ambulance. Okay, brought to the emergency department in an ambulance. Okay, so you can write like this. So rushed to the emergency department in ambulance. Okay, so Mr. Hemsworth was brought to the emergency department in an ambulance. So right. Okay, so his wife accompanied him and she told about the jerking movements. Okay, right. His wife. Okay, next line. His wife, what did she do? Okay, she informed that. So his wife informed that. So his wife informed that. What did she inform? His wife informed that jerking movements of the arms and legs, and he became unconscious. Okay, his wife informed that his arms and legs, or his limbs, his arms and legs. Okay, so arms and legs began jerking, and then he became unconscious. He became unconscious. He became unconscious. His wife informed that his arms and legs began jerking, and then he became unconscious. Okay. So next, face became blue, means pale. So you can say his face became blue, changed color, or became pale. Pale, bluish, became blue. Okay, his face became blue. After some time, he gained consciousness. He regained consciousness. He regained consciousness. After some time, he regained consciousness. See how the sentences have to be developed. So this is active voice only. He regained consciousness. Consciousness was regained. We can write passive voice also. First we are learning simple ordinary styles. Then afterwards we can improve. No problem. So note down these sentences. Very slowly will improve our quality. Jalvi, I was searching for you. Good, you came. Okay, all the new students, don't miss these classes. These are specially for these new students. Old students have already been writing. These sessions are specially for new students. Yeah. So, regained consciousness. We can say that. Hmm? Or he gained consciousness. He regained consciousness. He became conscious. After some time, he became conscious. Anyway, you can write. Became already we have used. So, regained consciousness. Or he came back to his senses. Anyway, you can write. That's not a problem. Okay. So, next one. So, there you can see. After assessment, he was diagnosed with tonic-clonic seizures. After upon after assessment, okay, assessment was done. Here you can see he was diagnosed with tonic-clonic seizures. After assessment, he was diagnosed with tonic-clonic seizures. He was diagnosed with tonic-clonic seizure. Yeah, he was diagnosed with tonic-clonic seizure. Active voice, I'm teaching you. Active voice, and also he was diagnosed with passive voice actually. So we can even write tonic-clonic seizure was diagnosed. After assessment, remove he, tonic-clonic seizure was diagnosed. So you can write like that. Then next, yeah. Now here, this one, past medical history is related here now. Okay. So copy text. So now here you can see head injury from a car accident 2 months ago. So he sustained or he sustained a head injury. Okay. He sustained a head injury from a car accident. Okay. He sustained a head injury from a car accident. Okay. From a recent car, 2 months ago, recent we can say. Recent car accident. Okay. Following which recent car accident, following which he has occasional headaches. Okay, following which he had uh, now also he has uh, occasional headaches. So occasional headaches, following which he has occasional headaches and blurred vision. This also you can write. And blurred vision. So here, following which he has not only occasional headaches, but also blurred vision. Like that you can write quality. Okay. So this is one way you can write. So you can write in different styles. This one, same thing. So step by step, head injury, occasional headaches. All these points are covered now. So rush to the emergencies, fainting, unconscious, wife accompanied, jerking movements, face became blue, recovered consciousness after 2 minutes, head injury from a car accident recently, occasional headaches, okay, and blurred vision. Because of this. So, so you can end up writing like this. So you can write your own sentences. Yeah. On assessment, he was disoriented and drowsy. He was disoriented, Vinita. He was disoriented and drowsy. And this is second paragraph. Now we'll go to the next paragraph. So shall we move on to the next paragraph? Shall we move on to the next paragraph? Okay, if you are writing, you can write your sentences. Otherwise, we'll move to the next paragraph. The second paragraph will be during hospitalization, what treatment? That's management. Come on, all of you write. Whatever you are writing, you write. You write your own second paragraph. Tomorrow you can submit this letter, or tonight you can submit this letter. So Vinita, Simiyat, Sangeeta, Habibullah, Kamal, Jyotika, Hafsa, Dalvi, Avil. Yeah. Come on, write down your sentences. Yeah, write your sentences, please. You already written, you can say yes so that we can move to the next paragraph. So you should write like a story. Yeah. So three S's. So now we'll move to the next paragraph. So body paragraph and the main body paragraph 2. The main body paragraph 2. Yeah. So now what are the points that will go into the main body paragraph 2? So here, yeah, mechanic, works in a workshop, smoker, 20 cigarettes a daily, all these things he already knows because he's, yeah. Now let us see. Now here you can see investigations, family history, forget it. Afterwards, these are the investigations during the hospitalization stage, management and nursing management. All these things are important. Okay. This will go into main body paragraph 2. Main body paragraph 2. Now let us see here. So hemoglobin normal, normal, EEG focal epileptic environment positive. CT scan showed subdural hematoma. Okay. CT scan showed subdural hematoma in the right occipital region. So this you can write. Copy text. So this you can write. CT scan showed subdural hematoma, revealed subdural hematoma of the right occipital in the right occipital region. That you can write. So that may be the first point. Then next one is focal epileptic variants positive in electroencephalogram. EEG. What is EEG? EEG. Yeah. Electroencephalograph. Electroencephalograph or gram. Okay. Yeah. This is medical specialized use full form. Okay. Electroencephalogram. Right? Electroencephalogram. Focal epileptic variants. Okay. Is revealed focal epileptic variants. So positive. So it showed. Right? It revealed. It was positive. Then next one. Now because of this, so phenytoin, anticonvulsant, medications, tablet phenytoin, 1 mg, 2 mg, 3 mg, 4 mg, 5 mg, 6 mg, 7 mg, 8 mg, 9 mg, 10 mg, 11 mg, 12 mg, 13 mg, 14 mg, 15 mg, 16 mg, 17 mg, 18 mg, 19 mg, 20 mg, 21 mg, 22 mg, 23 mg, 24 mg, 25 mg, 26 mg, 27 mg, 28 mg, 29 mg, 30 mg, 31 mg, 32 mg, 33 mg, 34 mg, 35 mg, 36 mg, 37 mg, 38 mg, 39 mg, 40 mg, 41 mg, 42 mg, 43 mg, 44 mg, 45 mg, 46 mg, 47 mg, 48 mg, 49 mg, 50 mg, 51 mg, 52 mg, 53 mg, 54 mg, 55 mg, 56 mg, 57 mg, 58 mg, 59 mg, 60 mg, 61 10 mg OD should be continued. But now this started here. Phenytoin, yeah. Twice daily. BD means twice daily. IV means intravenous. So this started. This was commenced. Consequently, this was commenced. And it should be continued. This commenced. Commenced. Should be continued. Also, post-discharge. Should be continued also post-discharge. Okay. And what else? Okay. Injection. IV intravenous. BD twice daily. So write like that. Injection phenytoin. Injection phenytoin 10 mg intravenously. BD means twice daily. Okay, this was commenced and should be continued after the discharge also. Yeah, I want to ask you, are we going in the right direction, you think? Are we going in the right direction? Yeah. After my question, can you give the answer after my question? Because yes, I don't know for which one. Are we going in the right direction? Are we learning quality? How to select the letters, how to select the words, and how to transform? CT scan. CT scan, you can write as computerized tomography. Okay, scan. CT scan. CT. Computerized tomography scan. Okay. Come on, just to give your points. Kamal, Nats, Habibullahi, Awil Narona. I really appreciate these guys who are responding very fast. Thank you very much. Because otherwise I'll not know whether you are following me or not. Okay, at least a yes sir and no. My mouth is dried up. Yeah, computerized tomography scan. Subdural hematoma in the right occipital region. So injection phenytoin. Phenytoin should be phenytoin brand name or generic name. Phenytoin brand name or generic name. So brand name should be kept. Phenytoin is the generic name. Okay, generic name. Okay, common brand names are Dilantin. Okay, so it's generic name, so you should not use capital letter. Okay, small letter should be used. Right, you change it when writing properly. So phenytoin is a generic name, so you have to write like this: P small letter. And next, fine. Yeah. Next, what else? And this phenytoin, along with this phenytoin, what else is he taking? So review for anticonvulsant. What else medication is he taking? Neuroconsultation provider injection mannitol, ticlopilate, injection TT, IM stat. Intramuscular. IM means intramuscular. Okay. So Uh, what type of medications are these? Ceftriaxone, amlodipine, injection, TT, dopilate, mannitol. So, so he has hypertension medication here. You can see. For this, he is taking tablet amlodipine, 5 mg once daily. So, in addition to this, this phenytoin is okay. So, so you can see already he is taking hypertension medication. He is on medication. He is on medication. Okay, for the last 5 years. Okay, in addition to this, how should be continued? In addition to in addition to the already existing already existing um, hyper medication for hypertension or antihypertensives, antihypertensives, antihypertensive medication. Okay, in addition to the already existing antihypertensive medication, you have to write like that. See how I am relating. Okay, should be continued. Injection phenytoin 10 mg intravenously twice daily commenced, which should be continued in addition to the already existing antihypertensive medication. So, so you can see here, this is related to here. He has this past medical history and he is currently on tablet amlodipine for the last 5 years. Okay, existing already existing antihypertensive medications. Okay, for the last 5 years. So you can remember that one. Okay, for the last he has been on this medication for the last 5 years. 5 years. Okay, if you want, you write, otherwise you eliminate. Okay. So already 5 years he is taking this medication. In addition to that medication, injection phenytoin is given. Then next one. So medication, injection phenytoin. Then what is advised? So now, then next what is there? So so this has come up along with this one because this phenytoin is already introduced here. So along with that one, it is going here. Okay, along with that one, it is going on, and along with that one, you can include the part of this also. So safety alert band. Okay, use of safety alert band. So use of safety alert band. So he is recommended to be used. Okay, okay. So next, what else? Avoid driving. So here you can separate this one or and write in the next paragraph also. Okay, you can separate this one, and the tablet should be continued. You can write in the third paragraph, or you can add here itself and break it into the next paragraph afterwards. So, um, so this you can use in the next paragraph otherwise. Yeah. So this in the body paragraph 2 you can write. Come on, continue with the body paragraph 2. You can write now. Yeah. So this should be continued. You can write in the after next paragraph if you want. Anyway, you can write. That's okay. Come on, write your paragraph. Complete your BP2. So yeah, if you take these points, yeah, computerized tomography scan, computerized tomography scan, which was ordered, revealed subdural hematoma in the right occipital region. Yeah, computerized tomograph scan, which was ordered. So this is during hospitalization. Okay, this is during hospitalization stage. Okay, so during hospitalization, comma, computerized tomography scan, which was ordered, revealed subdural hematoma in the right occipital region. So this is how you can add points. Come on, write down your sentences, please. Yeah. Next point, epileptic, focal epileptic variants. Positive. Okay. EEG. Electro, the electroencephalogram. Okay. Yeah. The electroencephalogram. Okay. Mm, showed, showed, showed uh, positive indications of positive for what? Showed positive for uh, focal epileptic variants. Yeah, epileptic variants. The electroencephalogram showed positive for focal epileptic variants. Epilepsy. Or you can write in passive, the epileptic variants were observed to be positive on electroencephalography. So you can write like this also. The epileptic variants, epileptic variants were noticed, were noticed. Okay, the epileptic variants were noticed to be positive on the electroencephalogram. Yeah, or were found to be positive, were noticed, were observed, were found. Anything you can use. Nobody is writing. Okay, right. Okay, no problem. Whatever you want to write, you can write. The anticonvulsant medication, okay, phenytoin, the anticonvulsant medication phenytoin. Okay, right. Was commenced. Anticonvulsant medication phenytoin was commenced. Okay. In addition to the already existing anti anti antihypertensive medication. The anticonvulsant medication phenytoin was commenced in addition to the already existing antihypertensive medication. Yeah, you can stop there. That's it. Next you can. So we can move to the last fourth paragraph, main body paragraph 3. Main body paragraph 3. Right. Okay. Main body paragraph 3. Next. Um, upon discharge, so this is upon discharge, following the discharge, post discharge. Okay, very good. Somebody started writing. I will Narona. Very good. So, upon discharge, what are we supposed to write here? Discharge plan. Patient should be patient discharge education. Wife also included. Okay, discharge education has been provided to both the patient and the wife and his wife. Okay, right? Regular monitoring is required. Okay, okay. So, continuation of anticonvulsant medication should be continued. 10 milligram OD once daily. Okay, once daily. That is twice daily, but here once daily. Okay. Uh, tablet. Their injection here tablet. So it is changed to oral. Intravenous change to oral. Hmm. So anticonvulsive, anticonvulsant medications. Okay. Anticonvulsant medication. Phenytoin should be continued 10 mg once daily. Anticonvulsant medication, comma, phenytoin 10 mg once daily orally has to be Continue. Okay. So how you want to modify and write, you write. It's not exactly that, just giving you the points. Okay. Next step. Safety band. Yeah. Now next one is safety alert band recommended. Safety. So use safety alert band that is recommended. Next one. Driving should be avoided. Avoid driving. Avoid strenuous activities. Avoid strenuous activities. Okay, next one. After avoiding strenuous activities. Okay. Monitor. Okay, monitor again if it happens. Reoccurrences or relapse. Okay, patient education, discharge education has been provided to both in order to monitor patient to be monitored. Wife is also included. Patient should be monitored by wife. Okay. So regular monitoring. Regular monitoring for any signs of relapse, reoccurrence of the situation. Then next step. For any signs of relapse. Next, he requires regular sleep and healthy diet. So regular sleep and rest. That's what it is. And excellent dietary regimen. Excellent dietary regimen, healthy dietary regimen. Healthy dietary regimen. So these you have to write. This is third paragraph will be a little bigger paragraph. Otherwise, you can write in two parts also. Okay, these are the what they have to do. Okay, the next step. Um, so follow up after 2 weeks. Follow up after 2 weeks. Review for anticonvulsant therapy. Review for anticonvulsant therapy. Anticonvulsant therapy. Yeah. So review for anticonvulsant therapy. So follow up after 2 weeks to review for anticonvulsant therapy. Then so these are the points which you have to write. Come on, body paragraph 3. You can write. Then next last paragraph. In the light of the above, in light of the above, or in view of the above, or in light of the above, or based on the aforementioned circumstances. So however you want to write, you can write. What is required? Continuation of care and treatment. So continuation of care and uh, necessary and continuation of care is based on the in view of the above or based on the aforementioned circumstances or the above mentioned circumstances. Continuation of care and mm, implementing the suggested plan of action. Implementing the action plan, follow-up action plan. Implementing the follow-up action plan would be profoundly beneficial. Would be profoundly beneficial to to improve the condition of Mr. Hemsworth in case any additional information is deemed extremely relevant. Please do not hesitate to contact me. That's it. Next, yours sincerely. So this is the conclusion. The conclusion. So that is done with the letter. See, people don't have time to listen till the end. So there'll be Hafsa, Nurse, Habibullahi, Simiat. Very good. So was the session useful? So you can give your points. Yes. Now, based on these points, you can write your own sentences. Yeah, thanks. All of you can write your comments, please. Give your feedback, whether it is useful and what way. So then we'll see the next session later.